Listing the different autoimmune disorders that are affecting the central nervous system, particularly the basal ganglia, is sometimes involved. We have the different listings ranging from the multiple sclerosis, Parkinsonian disease, we have the Huntington's chorea or Huntington's disease, and then we have another range of disorder which is known as the Wilson's disease. But what basically happens over here is it has its psychiatric complications and it has its physical complications due to the deposition of copper in the different organs of the body. So this is one of the disorders that can be seen, and it has its neuropsychiatric complications again. So we're going to summarize this Wilson's disease. What are the causative factors? What are the risk factors that make the person more prone to the development of this disease? Obviously, there are the environmental stresses, but there is a genetic predisposition as well that make the person more prone. And then if it is added upon due to those environmental factors, those environmental stresses, if they are present, then only the disease manifests itself in that particular individual who we're talking about. So first of all, the examination, the physical examination is again the mainstay over here. If you have a patient at your hand, he comes up to you and you're suspecting this Wilson's disease, the physical examination is very important. You're going to focus on that and look for the positive signs that can make the Wilson's disease one of the differential diagnoses. The background will be discussed over here, and then we are going to discuss the clinical presentation on the basis of which we are going to make the diagnosis, and after that the treatment modalities are decided further upon in that particular patient in whom we have diagnosed that Wilson's disease. So when we say the deposition of copper, so all the organs can be affected when this deposition of copper starts up. It can be a diseased liver from the copper buildup. So even the eyes are involved, the nervous system is involved, the liver, the GIT, all of these systems can be involved. So obviously the physical examination can reveal a lot, because when we start off with the systemic examination, all of these systems can be involved, and the positive findings can be found out even in the general physical examination or even in the systemic examination in that particular individual. The temperature is going to be normal. The blood pressure is almost sometimes a little on a higher range. The respiratory rate is almost 15 per minute. The pulse is a bit higher. That is almost 122. The oxygen concentration is in the normal range. And if you look at the patient in a general, no abnormality is detected, lethargic but arousable to the painful stimuli. So this is the general physical examination, the general orientation of the person. He is arousable on the GCS scale. The GCS scale may be at a lower range, but he is still cautious. The icteric sclera is one of the features that is observed on the eye examination. So the CVS, when it is involved, we are going to observe the tachycardia in this individual. Tachycardia is basically the raised heart rate that is observed in these individuals who are suffering from Wilson's disease. The chest is clear to the auscultation bilaterally. The abdomen is soft and the bowel sounds are present in such an individual. No clubbing or cyanosis and no edema is observed in these individuals. The patient is oriented but sometimes tremulous. So this is the neuropsychiatric examination. He's going to be oriented. He's going to be in a cautious state. But sometimes tremors are observed in these individuals on the physical examination. This is the Kayser-Fleischer rings that is quite commonly observed in a patient who is suffering from Wilson's disease. It's basically on the outer edges of the pupils that this ring is observed due to the copper deposition again. First written about in 1912 by Kiner Wilson. So he was the pioneer in this disease, autosomal recessive disease. The mutation at ATP7B gene on the chromosome 13 is observed in these individuals. There is a defective biliary excretion of copper. So this is the mainstay over here, that the copper cannot be excreted properly. 30 affected individuals per million population. Majority is diagnosed 15 to 35 years of age. And the children present with liver disease, adult with neurological diseases in these individuals. So the mainstay or the underlying pathology over here is the defective biliary secretion of the copper in these individuals, and it is due to the autosomal recessive disorder. And again, there is a genetic predisposition that make the person more prone to the development of such diseases. And again, the external stresses are again very important over here for the disease manifestations. When we look at the clinical presentation over here, the neurological manifestations are 98% have Kessler-Fleischer rings. Classification is dysarthric. Dystonia is observed in these individuals. They are tremulous, pseudo-sclerotic, or Parkinsonian-like tremors are observed in these individuals after the diagnosis. We can also see chorea that was basically also seen in the Huntington's disease or Huntington's chorea that was due to the extrapyramidal side effects that are seen in these individuals. Dementia is observed in these individuals. These people can also have seizures, a single seizure, or there can be a range of seizures or the episodes of seizures. Then these patients can also suffer from hyperreflexia, autonomic dysfunctions. Rhizus sardonicus is basically a grim-like position due to the spasticity of the facial muscles. There is a grim, or there is an expression of smile on the face of these patients, but that is basically pathological and is regarded as rhizus sardonicus in these individuals. Then we can have the psychiatric complications. The earlier presentation, the depression is the most common psychiatric complication that is seen in these individuals. The Kessler-Fleischer ring that we were already focusing upon, it's basically due to the deposition of the copper in the outer layers of the pupillary region, and that is basically manifesting as this yellowish discoloration in the peripheries of the pupils. So that is basically diagnosed when you examine the patient, when you examine the eyes of this patient, you can observe these Kessler-Fleischer ring quite commonly. The hepatic manifestations, they range from the asymptomatic disease to the acute liver failure. The younger patients develop the acute hepatitis, jaundice, and then the abdominal pain. The acute liver failure is due to the Coombs negative hemolytic anemia. Low uric acid is seen on the laboratory investigations, normal to normal low levels of the alkaline phosphatase levels. Coagulopathies are observed, and then the patients also suffer from renal failure after the progression of the disease. The psychiatric complications, they basically include the depression, and then the patient can also suffer from the emotional lability that is observed in the aggressive phases in these individuals. The mood changes are also seen in these individuals. Basically, the person is suffering from the bipolar affective kind of a disorder. The poor school performances are also seen in these individuals. Alcohol abuse is one of the phenomena that is quite commonly seen after the diagnosis is made, and then the person has an overall aggressive behavior in his overall attitude. So in this section, we focused on a disease which is basically due to the defective biliary secretion of the copper, and the deposition of copper leads to the formation of the Wilson's disease, and it has its own neuropsychiatric complication that we have discussed over here. So that is the end of this section. Thank you for watching sqadia.com.